All right, welcome to my channel, Dental Boards Reviews. I know some of you have been asking me to make the how to pass integrated national board dental exam, okay? Because I posted the how to pass NBDE part 1, an emergency plan. If you haven't watched it, I think it's also still applicable to most of the study strategies. But this one is the long awaited and mostly requested on how to pass INBDE. Okay. All right. And this is the ultimate study plan. So if you're going to follow this plan, you're going to pass. All right. And the information which is given here is my professional opinion. Okay. As a dentist, is my professional opinion on how to pass this integrated exam. Okay, so if you're not a subscriber, make sure you subscribe and continue following this channel. Okay, so for you to pass this exam, the integrated national board exam, you have to know what it is. All right. For you who are in dental school in the US, you already know what the INBD is, but you may have to read up on in the specifics of the exam. So you have to know the exam. For the international dentist, make sure that you know what the differences of MBD Part 1 and Part 2 and integrated national board is. Okay, so why was INBDE created? Okay, so INBDE is called integration, right? So this exam is emphasizing on the evidence-based dental practice. Okay, so the integration part, which is the I in the INBDE, okay. Some people will say, what is INBDE? They'll say they integrated part 1 and part 2, okay. But remember, I think the dental boards, the ADA got it wrong in the first place by separating the exams, okay, whereby part 1 is the basic sciences and then part 2 is the clinical sciences. But when you are in the chair and you are treating a patient, there's nothing like part 1 and part 2. Everything, the patient is one whole patient. You can't just focus on the basic scientific part of the patient and then the clinical part. It's all integrated. It's a patient. And also you have to include in that patient, you have to include the socio-economic factors and also practice management, the location you are treating the patient. Okay, so the emphasis of this exam is to make sure that the candidates are not just good at the part 1 part, the basic sciences, or the candidate is not just good at the clinical part, but they want to make sure that the candidate is very good at treating the whole patient using evidence-based scientific methods. So this exam integrates your classroom knowledge of the basic sciences, math, physics, chemistry, biochemistry, molecular biology, immunology, pathology, and the behavioral sciences such as psychology, socioeconomic status, and then also the research methods on how to appraise evidence. Okay, and combine that with the laboratory sciences so that you can use all that information to treat your patient in a safe and ethical, professional manner. Okay? Just imagine yourself if you're going to see a dentist. What kind of dentist do you want to see? You want a dentist, one, who is compassionate, ethical, and safe. And two, you also want the patient a dentist who knows his basic sciences, the evidence, a patient who is practicing according to scientific evidence, okay, and who knows what to do in terms of emergency. Can this dentist, If there's any emergency, can they handle the emergencies, right? So safety of the patient, ethics and professionalism, and clinical competencies. This is why IMBDE, in my opinion, in my professional opinion, is the best compared to just the separation of the sciences, of the basic sciences, and the clinical sciences. Okay, so finally, the ADA has gotten it right. Okay, so I think this is going to produce more competent uh, clinicians. And I say this because sometimes I see this in the residents whereby they're showing you the X-ray and they're focusing on just one aspect of the X-ray or one aspect of the patient, and then you ask what other aspects are there, and they can't give it to you, or they cannot combine the clinical part with the basic scientific knowledge, right? So I see that's a deficiency, and all these people have passed part one and part two, right? So if you're having a resident who is a dentist, okay, having difficulty integrating that information, it means even though they pass part one and part two, there is a disconnect somewhere. So I think eventually now that everything is integrated, people are going to learn how to integrate all the information they collect on the patient. Okay, this is the reason I like this INBDE. Okay, all right. So now the INBDE itself, as I mentioned before, focuses on the safety. Okay, the safety of the patient and the practice in terms of competency. This is clinical skills, right? And ethics. So, how is it divided? It's divided. The biggest part is that they want you to be a dentist, right? They want you to be a dentist. And what kind of dentist? A dentist who knows that the mouth is connected to the rest of the body. The mouth affects the health of the rest of the body. And so a long time ago, people used to think that the mouth and the teeth are just separate, entities from the rest of the body. But the emphasis is that you have to understand that the oral health affects the overall health of the patient, and so they want you to be a well-rounded dentist. Okay, so the majority of the focus is clinical dentistry. Okay, so it focuses on 56 areas. All right, so this is important. However, they also want you to know that there is the foundation knowledge. The foundation knowledge pretty much is what's considered classroom knowledge, whereby you have your chemistry, okay, you have your biology, you have your physiology, psychology, okay, and your laboratory skills, all right, laboratory and lab analysis, right? So, but this is the foundation. This is your foundation, meaning for you to be in dental school, they ask you to know the basic sciences, okay? Math, science, biology, biochemistry, physiology. They want you to know how the body works. And then once you know that, that's the basic foundation of any dentist. Now, this is mostly the requirement for dental schools to apply to dental schools in the US. Now, if you graduate from outside, your focus may have been different. So make sure that if you're studying for this exam, if you are not strong on the basics foundation knowledge, yes, you can jump to the clinical dentistry part, but it's not going to help you as a dentist, okay? And your incompetence is going to show over time. So make sure you understand the basics first, the basic foundation, okay? And then progress on to clinical dentistry, okay? So have your foundation strong. If your foundation is not strong, you can build a house, but that house eventually is going to fall, okay? with just small amount of force. So the most important thing is about INBDE is they're asking you, are you a safe, ethical, clinical dental provider, right? Do you know what you're doing? And do you know why you're doing it? Do you know when you're supposed to do it? Do you know when you're not supposed to do it? And do you know what you're doing? Okay, and who you're supposed to do this treatment on, and who is not you're not supposed to do the treatment on, and who you're supposed to refer. Okay, and who are you going to refer to? So they want you to see if you know all these things. All right, and how do you prevent these diseases? That's the main focus of INBDE. So it's completely different from part one and part two, whereby you just focus on the sciences. The part one focuses on the sciences without really thinking about the patient in general, right? And then part two focuses on the patient without really focusing on the basic sciences such as immunology, physiology, biochemistry part, right? But this is now everything together. When you see a patient, there's nothing separated from part one and part two. Everything the patient is one. Okay. All right. So make sure that you know your foundation knowledge. If you have any questions, by the way, you are free to always comment or email me at admin at theboardexams.com. Okay. All right. So moving on. All right. So the clinical part, right? So the clinical part, which is the dental, the largest part, which has 56 areas of the INBDE, okay, has three major parts. Number one, if a patient comes into you, what do you want to do? You have to have a diagnosis, and then you have to make a treatment plan. So this is a huge part, right? You have to know this. And then, of course, the oral health management and the practice and professional. Practice and professional meaning the OSHA, the research, the insurances, the patient management part is also here, okay? So you have to know this part. The clinical content areas, which is the dental clinic practice areas, okay, is the largest area. So you have to focus on it. Now, when you focus on it, it's not like you're just eliminating other things. You just know that when you're reading these things, you make sure that you retain that information, or you repeat it until you retain it. Okay? Repetition, repetition, repetition. All right? So let's look at each individual area, what's included, right? So the diagnosis and treatment plan. The old saying goes, don't do anything without a provisional diagnosis or a definitive diagnosis. You have to have a diagnosis, okay? So when you see a patient, how do you come about with the diagnosis? This is pretty much what I put together, okay, so that you know how to arrive at a diagnosis and treatment plan. Because this information here, okay, this and this is pretty much the entire assessment of the patient. It is going to help you come up with an assessment and a plan for the patient. So HPI stands for history of present illness. This is when the patient says, doc, I'm coming in because I have I've been having a tooth pain on the lower left, and sometimes I have swelling, which comes and goes, and the pain goes to my ear sometimes. Okay. So, one, and you ask the patient how long. Oh, the pain has been there for a month now. All right. And do you ask if they have any fevers or chills? The patient says, no, there's no fever, there's no chills. And sometimes I take ibuprofen for the pain and it goes away. Okay? So that's the history of present illness. The patient is giving you the history of present illness. Also, when the patient is telling you the history of present illness, their presentation, their history, they are going to give you their chief complaint. Okay? Make sure you know the chief complaint. Okay? Chief complaint. These days, sometimes instead of writing chief complaint, because nobody likes to hear that somebody's complaining, they call it chief concern. Okay, what's the chief concern of the patient? All right. So the HPI, history of present illness, you have to know that. Okay, you have to analyze that, and then you go to past medical history, PMH, past medical history, right? So the past medical history of the patient is going to give you the current health status of the patient. Okay, that's why I said the mouth is connected to the overall health of the patient. So don't just focus on the tooth and forget the overall health of the patient. You have to make and you have to know the past medical history so that you can safely treat the patient. Okay, so past medical history: patient has diabetes, high blood pressure, and past surgical history. They may have had some cardiac stents, placed, or they have had some knee replacements. They may have had some kidney transplants. Okay, so you have to know these surgeries, right? They may have had TMJ surgery, okay, which may limit your the mouth opening. So you have to know all these surgeries that the patient had. Sometimes you have to be firm when you're asking these patients, okay, because sometimes you ask the patient, oh, what medical do you have? Diabetes, high blood pressure, even psychiatric disorders such as bipolar schizophrenia. The patient will say, why are you asking me that? Okay, because they think you're a dentist, just gonna focus on that tooth. But you have to don't be offended. You just have to tell the patient, look, as a dentist, the things I do will affect the things I do are going to affect your overall health, and the medication I give you will go in your system, can affect your the systemic environment. Okay, so because it goes in blood. So the reason I'm searching for the words to use is because when you're talking to the patient, don't use scientific terms. You have to make sure that you break down the scientific terms into the language that the patient understands. That's called informed consent. Okay. There are people who go to consent the patient and they're using all these dental terminology and scientific terminologies. And the patient is going to be nodding as if they are understanding, because no one wants to appear as if they are stupid because they don't understand. So the patient will nod, but that patient, I guarantee you, has not understood anything. So you have to break down to layman's terms, okay, simple language. Don't use scientific terms when you're talking to your patient. Scientific terms are good for your colleagues, okay, when you're communicating between colleagues, or when you're documenting. But when you're talking to the patient, for them to understand, you have to break it down to the simple language, okay? And then you have to focus on the allergies, okay? So I'm spending time on this. Make sure that if you're watching this video, make sure that you complete the entire video and listen to it, okay? All right, so diagnosis and treatment planning is very important, and this is the information you need to collect and analyze before you come up with a treatment plan. Okay, so allergies: is a patient allergic to amoxicillin? Is a patient allergic to nuts? Is a patient allergic to sulfur drugs, right? So the allergies you have to factor in because it is going to affect what kind of medications you're going to give the patient, and the pharmacology of that medication. What are the alternatives to give that patient? Okay. The social history, meaning where does the patient now? Social history, people just focus on smoking and alcohol. Yes, those are good, and drugs of abuse. Those are good to know, but also social history includes where does the patient work? What does the patient do? Okay, because what the patient does may affect your treatment. So you have to make, and what kind of environment is the patient in? So you have to understand all those things so that you can make modification for the patient. Some patients may need some letters, for time off, all right? Time off work, a letter from the doctor, right? So you have to understand the social history involves smoking, alcohol, drugs of abuse, occupation, okay? Family history. Are there any diseases that run in the families? History of cancers, right? Medications. Medications. Make sure that you know what medications patient take. Okay, and not just taking like asking the patient to write down the list of medications. Know what those medications are. What's their pharmacology? What's the interactions with the most of the medications you give, which is lidocaine. Lidocaine is the most used medication in dentistry. So you have to know what's the interaction of lidocaine with this medication. How much should I give, right? Which medication should I avoid? Or which medication should I ask the patient's physician to discontinue for a few days, right? If the patient is taking some anticoagulants, right? Now, I had a resident who came to me asking me to check uh, uh, to check a patient so we can do treatment on him. But I said, is the patient taking any medication that can contraindicate to the patient? The resident said no. But, and then he listed the list of medication that the patient took, and there was this medication, Apixaban, okay? Apixaban, now you have to know, because Apixaban is Eloquis, right? So you have to know both the brand name and the generic names, okay? So because it was a Pixiban is an anticoagulant, we had to postpone the treatment, right? Or so that we can make modifications, right? So you have to understand the list of medication, not just collecting it, but also looking up that list of medications, see, which ones can contraindicate to the treatment I'm about to provide, okay? Or which one can increase the risks, okay, to this patient. So make sure you understand those things. Physical examination. Now, physical examination, make sure that you obtain vital signs, all right? Vital signs are important, are part of physical exam. High blood pressure will indicate the overall systemic health of the patient, okay? The temperature, the heart rate, okay? If the patient is coming in with a heart rate which is already at 101, and the patient is an adult and not a pediatric patient, pediatric usually they have high heart rate, but if the patient has tachycardia to start with even before the treatment, and then if you're going to use lidocaine with epinephrine, then you have to be careful on how many you're going to give, right? So vital signs are important or part of physical exam. Make sure you do that and make sure you review it, okay? And period charting. Period charting is key in dentistry. How can you treat oral health without knowing the status of the periodontium, right? So period charting is key to physical exam in dentistry. So make sure in your exam you include period charting. So make sure you know how to review a period chart. which one is considered gingivitis, which one is considered periodontitis, and how do you treat them. Radiology, and then after that you review the x-rays. When you review the x-rays, then you review the labs that the patient may have come with the labs. All right, so you review the labs, and then once you review everything, your assessment, you make an assessment of the patient. Or for example, you say this is a patient, this is a 20-year-old healthy patient with no medical problems, no allergies, who has a carious lesion on tooth number 28 extending to the pulp, right? The tooth is tender to procation, all right? All those things you have to, so, and then currently you can say that if there's any contraindications to the treatment you're providing, right? So, but the assessment includes all the information you collected, all the above information, okay? HPI, past medical history, past surgical history, allergies, social history, family history, medications, physical exam, radiology, and the labs, all right? Once you make that assessment and the diagnosis, okay, and make a diagnosis, okay, as I mentioned, the diagnosis can be provisional diagnosis. The provisional diagnosis is, for example, a diagnosis which you have initially, okay. For example, if you see a lesion, you can say, oh, that lesion is like implanus, right? But you are not sure. Visually, you can see it, but a definitive diagnosis is going to come from histology, so you have to do a biopsy on it. All right. So assessment is going to include the exam and all the information you've collected and the diagnosis. Once you have that diagnosis with your assessment, and then you make a plan, treatment plan. All right. Treatment planning, meaning what are you going to do first? All right. Am I going to stop this patient from smoking? What can I prescribe? If I prescribe this patch, is it safe? Is it going to interact with other medication the patient is taking? So you have to put all this, plan according to what's going to be done first, and what are the alternatives to that treatment plan. All right. Alternatives are important. All right, in any part of healthcare. All right. So the other part of the clinical part of INBDE is the oral health management. Okay, so the oral health management plan part is to make sure that you are delivering a safe care to the patient. Okay, remember I keep saying safety, safety, safety of the patient. So you have to make sure that that's the focus of your treatment. Okay, not just to pass this exam, but as a clinician, as a safe, competent, ethical, professional dental clinician. Okay, that's what you want to be. I'm sure most of you, those are the goals you have, not just to pass this exam. Yes, you're going to pass this exam, but are you going to be competent in the end, right? So, according to the patient, the oral health management emphasizes any modifications that you're going to do on the patient, okay? And it also emphasizes on the question on, are you able to manage medical or dental emergencies if they happen? So the prevention part, because prevention is the best way to manage medical and dental emergencies. And how do you prevent things? Is by doing your due diligence, by reviewing all the patient's medical history, surgical history, allergies, medications, okay? As I mentioned before, so that you can make up an assessment plan which is safe for the patient and prevent any emergencies. And then the other thing is, if you have emergencies, how do you handle it? As I mentioned, the best way to prevent emergencies, the best way to manage emergencies is to prevent it. So you have to make sure you are ready. You have all the emergency drugs or all the emergency protocols, and your team, your assistants, the front desk, everyone has to know what to do in terms of emergencies before you start. Okay, all those things should be should be engraved into your practices, as to the point whereby you don't even have to think about it much. It becomes natural. You see a patient, you see the health history, you see everything else. You already know what to prevent, what to do to prevent any emergencies. Okay, and is every patient who sits in your chair supposed to be treated by you at that point? No, it's not necessary. So to prevent emergencies, you may want to postpone the surgeries, and the environment when to do it. In certain patients, it may be good to do the surgeries in the morning, and which patients are good to do surgeries in the morning? Which ones are good to do the surgeries in the afternoon, right? So all those things make you a good clinician. It's the integration of the information, both the basic sciences and the clinical sciences all together to help that patient. Okay. So this is the oral health part mostly focuses on prevention, medical emergencies. Okay. And then there's the excuse me. So and then there's I'm supposed to be exercising, so that's the reminder. But and then there is the practice, okay, the practice and profession. So the practice and profession part of the INBDE focuses on you as a profession and also your dental practice, meaning it comes up with the OSHA, okay, the quality control. What's the infection control procedures that you have in your clinic? How do you handle biohazards, right? And then also the insurances, your professionalism in terms of what laws you're supposed to follow as a dentist, right? Procedures and policies. So this is what it focuses on. All right. So this IMBD is well grounded. This is what we do in dentistry. All right. It's everything is integrated in that one patient. All right. So this is a good exam, and I don't see it as a difficult exam. I see it as a simple exam, if you're a good clinician. Okay. So, and then that was the clinical part, which comprises about 56 areas. The foundation knowledge part encompasses about 10 areas, right? So, but the foundation, it's called foundation knowledge because this is the foundation, it's the basic knowledge that you need even to become a dentist, even to go into dental school. Okay, they want you to know your physiology, your pathophysiology, biochemistry, immunology, genetics, right? Pharmacology, because you use a lot of drugs, behavioral sciences, patients who have, for example, cerebral palsy, how do they react? Patients who have Down syndrome, how do they react? Patients who have ADHD, how do they react? Patients who have autism, how do you manage them? The children, how do you manage them, right? The behavior sciences, the psychology, the anxiety, what causes the patient to have anxiety, right? The fear of unknown. So you may want to spend time. You may want to know how to recognize those signs, right? And know how to handle it or how to prevent it. All right? So the foundation is how you build your house. You need to build a strong foundation. So there are some people saying, oh, INBD is just like part two, just focus on part two. yes, you can focus on part two, but your clinical knowledge may crumble when put under test. Okay, yes, you're going to pass, that's fine, but you need to freshen up your basic science knowledge. Okay, if you graduated a long time ago, I would advise you to focus, on the basic science knowledge. And I have a list. When you continue watching this video, I have a list of like which sections. If you graduated from outside as an international dentist and you haven't done your basic sciences, I have which sections you need to do first. And then for the dental students who are here in the US, I have a list of which you can focus on. Okay. So make sure you review your fundamentals. Okay. All right. And then the exam itself. So the exam itself, I think it's fair. Total of 500 multiple choice questions. All right. So you still have choices, multiple choice, and it's 2 days. It's divided into days. Day one, you have 8 hours. This 15 minutes is mostly for instructions that they give you. All right. So 8 hours to answer 360 questions. And for the 360 questions, there is 4 sections on day one. There's 4 sections, okay, and each section is divided into 105 minutes for 100 questions for the first three sections. The fourth section has only 60 questions. Okay. So you don't have much time. You have to make sure you are able to answer those questions in less than a minute. I repeat, you have 100 questions for 105 minutes. All right. So that means if you take a 1 minute for each question, you're going to have almost, about 5 minutes left by the time you finish. So you have to make sure you are fast. You look at the question, you answer it within a minute or less. All right. Don't take, if you see you're taking more than a minute, just click, mark, and move on. All right. And on day two, there is 4 hours. Again, 15 minutes. This is only for you to read the instructions. It's not included in starting the exam. So 4 hours and 140 questions, and these are going to be case based. All right. So they are divided into 70. So all this information is included on the ADA website, on the manual of INBDE. Okay, so make sure you review that PDF manual. All right. So make sure before you start this exam, make sure you know what it is, what is requiring, why it is being given. It is being given so that they can know whether you are at entry level as a dentist, you are able to provide safe, competent, ethical dental services. Okay, and able to manage emergencies. So when to take the INBDE? When should you take it? Okay, so for US dental students, ideally you need to take it in the second semester of your third year. Okay, ideally. Yes, if you want, you can take it early, but it's not. If you take it in your year two, in your second year, because most dental students don't have clinical experience in the second year. So that, yes, you may pass for those people who know how to take tests, but your knowledge is not going to be the same because you don't have the clinical experience. So it's not going to be beneficial when you're studying for this, right? So my recommendation is ideally take this exam the second semester of your third year. Now, your school may give you different timelines. So make sure you ask when you are able to take this exam. Now, as international dentist who wants to be eligible to apply to advanced standings programs, you can take it whenever you meet your eligibility. Okay, so whenever you're ready, you can register and take it. All right, so there's not much restrictions unless if you're eligible international dentist. Excuse me. All right. The Now, how do you, if you watched how to pass my video on how to pass the national boards part 1, okay, the principles are the same. A few things have changed, so make sure you pay attention to this one. All right, this is how to pass INBDE. All right, so number one, what I always recommend that you schedule your exam date after you get your eligibility. Okay, make sure you schedule for your exam. Now, if in terms of the time frame, when should you schedule for the exam? Should you schedule it in 4 weeks, or should you schedule it in 4.5 months, right? So ideally, if you are a graduate of the US, if you're in dental school right now, okay, if you're a graduate of the US dental schools, it should take you about 4 weeks to prepare for this exam. Serious studying. Okay. Now, if you graduated from outside as an international dentist, okay, you need a minimum of 4.5 months. And I'll explain to you why, okay? 4.5 months. And I repeat that because when you schedule for your exam, so you can schedule for your exam in 4.5 months, in 5 months, or in 6 months, okay? And if you are a graduate of US, you can schedule exam at least within 4 weeks. Yes, you can take longer. You can even take for 4 months if you want. But I think your basic knowledge is good enough for you to focus on the second part, which I'm going to show you. So this acts, when you schedule for the exam, it acts as a deadline, and it's going to push you. It's going to push you to study, because when people work with a deadline, they work harder. You work hard because you know you have a deadline to meet. Okay? When you study without a deadline and somebody asks you, when are you going to take the exam? I haven't scheduled yet. I have to schedule, because you don't know. So you end up not taking your studying so serious. Okay? Because there's no urgency. You don't have a deadline. So make sure you schedule your exam so that you have a deadline. Okay? Now, what I recommend is that do not study for more than 6 months. Don't study for this exam for more than 6 months, because if you study for more than 6 months, there's a risk that you may forget the initial information, critical information that you studied, okay? And you may have to go back again. You're supposed to go to review multiple times, but make sure that you don't continue reviewing for too long that you end up forgetting. All right, so no more than 6 months. Now that you have scheduled and you have your timeline of studying, now what do you do next? Let's see. Okay, the next thing is that now you select your study sources. Now here, your study sources, what do I recommend? All right, so I recommend you find 2 to 3 sources for this exam. Okay, and as I mentioned before, when you select a few curated resources, this is going to make you focus on these resources. They're not going to, because we have so many resources, you get confused. You pick up one resource and then you pick up another and then you pick up another. And then the one resource says something else, the other resource says something else, the other resource says something completely different. And so you are confused. And then you become anxious. So when you pick up few resources, it decreases anxiety and increases your focus on the material you have. Okay? So make sure you choose very few resources, and the fewer resources, the better. Now, what resources am I recommending, right? So I am recommending the Dental Decks. Now, which Dental Decks am I recommending? I'm recommending INBDE Dental Decks. All right. Now, we're going to review. So now I have no association. I have no association with the Dental Decks group. I have no association with the Mosby group, and I have no association with the Dental Mastery apps. Okay, these are my professional opinions on how to study for this exam. Okay, based on the information contained in this material. This information is sufficient for the candidates to pass the exams. So make sure that you look at the dental decks, all right? And the dental decks are going to help you in terms of becoming organized, all right? The Mosby, all right? Mosby, make sure you at least Mosby for INBDE or Mosby for NBDE Part 2 is very good. And then Mastery App for INBDE, all right? Mastery App, why do I recommend Mastery App for INBDE? Because I believe when you do dental decks every day, right? Dental decks have questions and they have an answer and explanation in the back. Yes, that's good. But Mastery App, whenever you are sitting on your couch watching TV, you can have it on your iPad, your iPhone, or your Android phone, and you can do at least 10 questions in that section that you did on that day. I always recommend that before you go to bed, do a quiz on what you just studied. It's going to help you know where you are, where you stand in that section. So the Mastery app is going to help you provide those quizzes, right? Because you can select a section and do the section, for example, dental anatomy or operative dentistry. Okay, so you can select those and do those questions every day before you go to bed. Do some questions on Mastery app. All right. Mosby. Once you finish the decks, make sure you read Mosby. Mosby is going to help you a lot, okay? In terms of endodontics, special management, pediatrics, and orthodontics, it's going to help you a lot, all right? So, these are resources I recommend. Now, other resources that you may use, okay? The other resources that are helpful are the Tufts pharmacology, okay? That's it's easy. It breaks down things, okay, in terms of questions, explanations. So you can use these ones if you have time. If you have finished these ones, these are the main study sources that I recommend. If you finish this one and you want to review Tufts pharmacology, you can do that. And also the ADA Code of Ethics and Professional Conduct, which are found on the ADA website. Those are very helpful. Okay? So these are resources I recommend. Now, dental decks for INBDE, okay? So I included this because it's very helpful, the way they have organized it. And most of the organizers of this INBDE, when you look at people who've written it, these are people who've been in the profession for a long time. And these are professors. They know, okay? They know what's important to be a competent and safe clinician. So this is the reason I am picking the dental decks for INBDE. Okay. Now, some people may ask, "Oh, I have dental decks for Part 2." Yes, you can use the dental decks for Part 2, but you have to make sure that the sections which are covered in INBDE are included. Okay, so you can study, you can use the boards for part two, but make sure you include certain parts which, like the knowledge update, the knowledge foundation, the foundation for knowledge, like the basic sciences. You review some of that also. Okay, but but that's going to you have to be organized for you to do that. All right. Yes, it's easy, it's cost effective because some people have dental decks which are being passed down or being given to them from other people. Yes, that's good. But the IMBD dental decks are going to help you stay organized. You have one resource which you can go to, and it's going to decrease your anxiety. Now, the reason I recommended about 4.5 months for you to study and no more than 6 months because these dental decks, they are about almost a little bit over 2,700 comprehensive flashcards. Okay, and so if you're going to do about 20 dental decks per day, then 4.5 months is sufficient if you're going to do 20 dental decks per day. If you do less than that, you may take more than 6 months. So make sure you pace yourself. Okay, make sure you are consistently doing certain amount of dental decks. So make sure when you get the dental decks, and this is not an advertisement for dental decks. Okay, this is just to make sure that you pass the exam. I have no relationship with the dental decks or the people who have written these dental decks for you to pass. Okay, so, and it also has case study booklets. All right, and the way they have done it now, the dental decks, they have put the you can buy the dental decks box which are printed. Okay, I think the cost for the dental decks is 599, but there's also a subscription for 12 months, I think, which includes, which you are going to be, for those people who like to study on the computer. You can use that electronic flashcards, and they have also practice online exams. And also the flashcards have quizzes that you can do every day. Okay, after you do a section, you can do quizzes on that section every day. Now, they also give money guaranteed if you have done 75% of the dental decks, and at least, I think it's 3/4 or 2/3 of the exams. Okay, so they have about 3 exams, 500 questions, practice exam. Okay, so you have an opportunity for you to take these exams. All right, and they have a neuropathology booklet and photos. So yes, you may have other resources, National Board Part 2 flashcards, which is okay to use, but IMBD dental decks are helpful and well organized and geared for this exam. Okay, it's not going to make you choose so many resources. All right. Now, now that you have scheduled your exam, you have selected your resources, your 2 to 3 resources. Okay, then you need to buy a notebook and pens. You need to take notes when even if you are reviewing the flashcards. You can write on your flashcards, but ultimately you need to have a notebook which you take notes and write down principles and certain things that you may forget, so that you review. Each week, you need to review your notebook. At the end of each week, review your notebook. Go back and review what you have written in your own handwriting. And sometimes when you're reading it, it sticks in your head, it sticks in your mind. But when you write it, it sticks even better. And we come and review it, it sticks. It sticks, so that you know the principles, okay, of what's being asked. So make sure that you get a notebook, and to make it colorful, which I put different colors here. You can buy different color pens so that you make it colorful and make it easier for you to study for this exam. All right, so you don't feel depressed when you're looking at a black and white paper, or just a black and blue or paper. So make it colorful for yourself. Make it interesting for yourself. Okay. All right. You can use highlighters too. So okay. So and then study time. Some people say, "Oh, I'm married. I have children. I have been working." Make sure you create time. You create time by one, you tell your goals and objectives to your family members, your husband, your wife, okay? So they can take responsibilities. If there's certain responsibilities you have in the house, you may want to share them. You say, look, my partner or my husband, my wife, I need to study for 4.5 months, or I need to study for 1 month, or I need to study for 6 months. And these are the sacrifices we need to make. I need you to help me do these things so I can have time to study. The goals also, it helps to tell your boss at work. Say, look, this is my goal, and I'm studying for this exam. And at the end of your exam, you need to tell them that you need some time off to study for the exam. Okay. But you need to find time. You need to study at least 6 hours. At least 6 hours daily, okay? But what I recommend is 8 hours. All right. So that's almost the whole a full work day, right? So make sure you have time. But at least 6 hours studying. You need to create time. You need to find time. You cannot say I'm busy. If you are busy, don't take this exam. But if you are excuse me, you are dedicated to taking this exam, find the time to study for it. Yes, you can use hours such as 4 hours. Okay. But if you do 4 hours, that means you have to study every day. Every day. And sometimes if you're at work and you have a break, you may take flashcards and just review your flashcards at work. Okay? During your break. All right? So make sure you find time. There's no excuse for not having time to study for the exam. And remember, you have a deadline. So when you have a deadline, you're gonna do everything you have to do to meet that deadline, so that you are ready by that deadline. Which is the reason it's very good to have deadlines. Deadlines will push you to accomplish what you need to do. Okay, so make sure you schedule for your exam first. Have your study materials, and create the time to study. Okay, there's only 24 hours in the day, and you have to find time to study within that 24 hours. And then your study environment. I think I have for those people who have heard my other video on how to pass NBD part 1, is that I can study in any environment, right? That's because that's how I trained myself. But if you're a person who likes to study in a coffee shop, make sure you go there. Make sure you have a routine. Say, okay, I'm going to coffee shop. This is what I'm going to do. Okay. And when you go there, you say you have a goal. Say, okay, I'm going to study. I'm going to finish these 20 flashcards a day. Or some people like to study in a quiet environment, right? Like the library, at home. So whichever is your study skill, make sure that you find your environment which can be conducive for your studying and learning. Okay. And whatever environment you choose, you need to have very few things on your table. Very few. Why? Because very few things will make you focus, will decrease your anxiety. It's going to decrease the clutter around you. You just have to have some pens, a notebook, and flashcards. Now, don't bring the entire box of flashcards, right? Just take the section, only one section on the table. The section that you're doing is the section you need to have, all right? So that you're not overwhelmed. When you're looking at the entire box full of flashcards, you're thinking, oh, when am I going to finish this, right? So you become overwhelmed. But when you have a small section, you're like, okay, I'm close to finishing. So when you finish that section, you feel accomplished, right? So you're having small tasks to accomplish small tasks in order for you to have a big task accomplished. All right, it's a divide and conquer method. So make sure that you use that you take small sections and finish them. Okay, so you feel accomplished when you finish that section. All right. Okay. The other things that I always say is limit social media. Social media is now part of our life. Okay. We have people who are meeting dates online now. You have people who are learning, purely learning, everything online, just social media everywhere, right? But for you to focus on this exam, you have to limit social media. You need to log off. For those of you who receive messages and notifications on your phones, make sure you turn it off or you log off while you're studying. This is going to increase your focus, and also you can reward yourself after, for example, after a certain amount of time studying. You can reward yourself by logging back in at the end of the study session. Okay, if you have social media accounts, some social media accounts allow you to deactivate. If you reactivate that within the same day or within the I think it's 90 days, you still have your information there. So, but if you log off and you deactivate that day and you reactivate the same day, you're fine. So make sure that you log off so that you're not distracted with social media. Because one, there's somebody who I asked why they don't study. I say, oh man, I have so much distraction. They have Facebook, they have Instagram, they have Twitter, they have WhatsApp, and then there's personal messages, right? And then they have phone calls from family. So it's so much distraction, right? And if you start scrolling down on Facebook, Instagram, Twitter, Pinterest, all those things, you end up spending a good 1 hour, 30 minutes, right? So make sure that you don't waste your time. All right? All right. So the let's see. So make sure you turn off your phone while you're studying. All right. Now, the section to study. The section to study in these are the dental decks in terms of what you need to study first. Okay. So number one, as I mentioned again, we are dentists. So as dentists, we need to know dental anatomy and occlusion. So if you are dental anatomy and occlusion, even if you study from here in the US or you study from outside, you need to know dental anatomy, okay, and occlusion, because we are dentists, okay. You don't want to have a dentist who knows everything else, but they don't know much about the mouth. What kind of dentist is that, right? So you want to know dental anatomy and occlusion. If you graduated from here and you think your dental anatomy and occlusion is very good, knowledge is very good, that's fine. But make sure you review quickly and move on to other sections. All right. But this is mostly for people who graduated from outside, international dentists. Okay, whose knowledge base may not be so broad. Make sure you start with dental anatomy and occlusion. And then anatomic sciences. Now, when you do anatomic sciences, focus on the head and neck anatomy, okay? Because when you study dental anatomy and occlusion, the diseases of the teeth, depending on anatomic area, the abscesses may progress to head and neck region. So you need to know your head and neck anatomy, or certain pathologies which go from the mouth to the neck, right? So you need to know those things. And then there's a physiology and biochemistry. Now, when it comes to physiology and biochemistry, yes, biochemistry is good, but I would like you to focus on the physiology part, okay? When you're studying, make sure everything in physiology, make sure you know how the heart works, the kidney works, the liver works, okay? Because the drugs you give are either metabolized by the kidneys and eliminated by metabolized by the liver and eliminated by the kidneys, all right? By the how are they going to affect the heart? So you need to know all these things. So physiology is very important, okay? And then the microbiology and pathology. You need to know the the bacteria that are common in the mouth, right? Because that's going to affect the antibiotics you give. The most common pathologies. So then you do oral pathology, okay? And then once you do that, now that you have studied the physiology, the microbiology, the oral pathology, then what medications can you give to treat these diseases, right? Then it comes to how you learn about the lidocaine. You need to know the antibiotics, amoxicillin, clindamycin, right? The beta blockers, right? Calcium channel blockers. So all these things you need to know. Then once you do that, then you learn about the endodontics. Okay. Now this part. So 1, 2, 3, 4, 5, 6, 7. This part is what you study. You can do this, okay? You need to study this and then study this. All right? And I put the research methodology and analysis and the radiology towards the end, okay? Yes, you need to know them. You need to brush up on them, all right? But the periodontics, and I think I put periodontics twice here, all right? But periodontics and pediatrics, patient management. Make sure you know very well patient management, okay? Very, very well. Remember, patient management deals with how you're going to handle different types of patients, right? Their insurances, how you're going to charge them, all those things. Very important part of dentistry, patient management. Okay, that's why sometimes the patients may sue somebody because they feel they were not well managed or treated. Okay, uh, even though you may be very good at doing a class 2, you know, or doing a dentistry in general, but if you're not good at patient management, you're going to fail. All right. Then post-operative orthodontics or surgical pain control. Okay. Now, if you are a graduate of the US, you can quickly review dental anatomy and head and neck, and then move on to this. Okay, that's so. If you are a U.S. graduate, you can do this one, which is meaning dental anatomy occlusion and head and neck anatomy, and then you can move on to oral pathology, pharmacology, endo, pediatric, okay, and patient management operative. You can move on to these parts. All right. If you're a graduate from outside, I would review everything thoroughly. Okay. So if you have any questions, we can always discuss. You can email me so we can discuss. All right. So you need to organize your notes. The notes that you take in your notebook, make sure you organize them. Make sure you record your start time and your end time. For example, saying the start time, for example, 8 a.m. January 17, 2021, and you are starting at which flashcard. So you can say I'm starting at the flashcard to number 200, and this is the end time, right? So make sure you record your start time, your stop time, and highlight. Make sure you highlight. This is going to help you a lot, okay? And then every 3 hours that you studied, may take 15 minutes break. Walk around, talk to somebody, have a discussion. That's 15 minutes break. Once it's done, at the end of each day, as I said, do the questions on Mastery app section before you go to bed. It helps every day. Don't go to bed without doing quizzes by testing yourself. All right? Test yourself on what you just reviewed. Don't take a quiz on something you haven't reviewed already, because that's going to increase your anxiety when you get a bad score. make sure you review on the things that you just studied. Those are the quizzes you take. Okay? And then watch videos on concepts you need to clarify. Now, on YouTube, I call it University of YouTube. There's a lot of videos. Okay? So, after you do the quizzes, or even after you study, you can watch some videos, and then once you finish the videos, take your quizzes on the things that you studied that day. Okay, so, or you can do either way. You can study the section for that day, take the quiz for that day before you go to bed, and watch some videos. All right. Yeah, some people watch videos on their phone while they're in bed. Anyway, okay. So make sure you record and take some breaks. Okay, and also watch videos. Now, some people have asked me what videos should I recommend. Now, the videos that I'm recommending, of course, I'm recommending my own videos, my own channel, okay? But also, I'm recommending this video, which many people have said it has been helpful, the Mentor Dental, okay? So these are the channels I'm recommending. I think not just because this is my channel that I'm supposed to be helping you. This is my plan to help, but also I think it has very good videos that break down certain principles. Okay, so these, I think there's so many videos on YouTube, that so many channels. Yes, you can pick and choose, but when you have so many resources, you get confused. So pick a few and go with it. Now, here's a quote from one of the students that provided feedback. He says, "What was helpful for me is attending dental mentor," or he meant mentor dental. Okay, so this is mentor dental, and dental boards reviews. This is my channel. Okay, this is another channel. All right, on YouTube, they gave me good information and guidelines. So these are the things, and this is somebody who just passed INBDE. Okay, when I say just passed, they passed it in I think it was September or November. So, but this is the comment he gave me. All right. So there's so many, and then there's another one who just commented on the channel about the channel itself. But the key is to select a few resources and go with it. All right. And this channel has a lot of good information. Okay. Also. Now, so watch videos on concepts you need clarification on. If you think you're reading something and you don't understand, now there's a lot of videos that can clarify that concept. All right. Now, this is very important. I think many people have emailed me about how this has helped them a lot. Okay, close to your exam. Now that you have studied for about 4.5 months to 6 months, close to your exam, take 1 to 2 weeks off to study and review. Okay, take 1 to 2 weeks off to study and review, because when you do that, you need to take the practice exams. One, the dental decks for INBDE has 3 practice exams. You can take one of them and assess yourself. Now, when you take the exams, make sure you take notes on all the questions that you get wrong, so that you know and review them. Okay, and then during this week, this is the time you're going to review your notebook notes. The notes that you took in your notebook during the studying, you need to review it again. Remember, at the end of each week, you need to review your notebook, but at the end, towards the end, in the 1 to 2 weeks off that you're off, make sure you review your notebook. It's very important to understand what you have written down in terms of information. You understand your own handwriting, okay? And you know what you meant by writing those things. It's very helpful, all right? So a lot of people have said this strategy has helped them a lot at asking asking their bosses to take off. Remember, as I said before, if you ask your boss to take a week off so that you can study for your exams, that is going to help you, improve in your future. Most bosses, they are going to support you. If the boss doesn't support you, it means that work is not for you. Okay? So most bosses are going to support you and they're going to give you a time off. All right? So make sure the 1 to 2 weeks before your exam, you take some time off. Okay? It's going to help a lot. Now, the summary of this is make sure maintain a consistent schedule to study. So if you study every day, Monday through Friday, make sure that's what you do. And Saturday you can be with family. Whatever schedule you need to set, make sure you're consistent doing it. And first, you need to register for the exam so that you can have a deadline. And then the time frame we said about 4 weeks, 4 weeks for about the people who are studying in the US, and 4.5 months for international graduates. Okay? Also, tell your family, friends, and boss your goals so they can support you, so they can know and also push you. Sometimes you may go and have fun, and the family member say, "Hey, are you supposed to be studying?" So make sure you let your goals of studying and passing the INBDE known to your family, your friends, and your boss. Okay? Close to your exam, ask for 1 to 2 weeks of work so you can review your notes, take a practice exam. Okay. Now, why take a practice exam? When you take a practice exam, it's going to and the exam has to be timed also. It helps when it's timed because it's going to build your stamina, your mental energy, your mental stamina for you to carry on to see if you can actually take the 500 questions within that amount of time. Okay. All right. So record your start time in your notebook and your end time and the date that you're doing it. So every day you're supposed to write the date. That's a good practice anyway. And if you're in at home, make sure you put your a do not disturb sign. Okay. If you're in a library, be in a quiet place. If you like to study in noisy environments such as the coffee shop, that's fine. Just have some music. And sometimes I say that if you're tired, if you're coming from work tired, sometimes you drink coffee, the coffee doesn't work, and you're still falling asleep. Make sure that you put some music on. Okay, you can just don't put some relaxing music because you're going to fall asleep. Put some music which you cannot fall asleep on, and try to review some cards. The other thing is, so when you are sleepy and tired, avoid quiet environment if you're going to study. Make sure you're in a noisy environment so you can go to a coffee shop, all right? So that you can be awake, stay awake, all right? But whatever you do, make sure you have a consistent study time and undisturbed, okay? And if you have any questions, just make sure that you message me, you email me, and then just let's see what else I can do to help you succeed. Okay. Now, if you haven't watched the How to Pass NBDE Part 1, I think it's also a helpful video. You can use that and you can use this one. I think this is a good way to make your plan and pass this exam. Okay. Make sure you follow these steps that I mentioned. Make sure you watch the entire video. All right. and make your plan. Okay, so make sure you subscribe and share this video for anyone who can benefit. Okay, whether you're a dental student or international student. All right, good luck.